you have all types of additional costs. So the opportunity cost into the workforce today, you may get your wages, but you have to deal with your children. You may have to pay child care or support for your children. You have commuting costs. You have all types of additional costs. So the opportunity cost of going back into the workforce today is extremely high. So as the governor said, if you're not willing to go back in the workforce, the governor may cut off some of those benefits to change that equation of what the opportunity cost to stay home is versus the opportunity cost to re-enter the workforce.
So, when all this comes in terms of the spending here, the government's already spent more than $2 trillion to stimulate the economy. That frankly, there's no end in sight. They're going to keep spending until they don't need to spend. And right now, there's no problem borrowing the money, right? It's essentially free, except for nothing is free in the long term. And the question for you, Gary, is could all this spending with really no concern for the price tag lead to a bigger economic crisis?
And you said it yourself. It may look free and it may feel free today, but we are creating a longer term problem that could turn into the next crisis. I said could turn into the next crisis. We are going to put another $2 or $3 or $4 or $5 trillion of deficit into the United States. We could end up with $25, $27 trillion of deficit. We have to finance that deficit. To the extent that the world allows us to do that, we have no problem. But if we get to that horrible, horrific point where the world no longer wants to finance our debt, and we cannot self-finance with savings in this country, we then have another crisis on our hands where the U.S. cannot borrow money and interest rates in the United States go dramatically higher, which has an immediate impact on every homeowner, every auto loan, every mortgage, and every student loan in this country, where the rates on those loans are going to go dramatically higher, and we're going to have a real impact on our economy.
All right, Gary Cohn, thank you very much. A sobering thing to consider, but an important one, given obviously that debt is now greater than the size of the entire economy, which is traditionally a big red flag. Thank you very much. So I appreciate it.
Thank you. Thanks for having me.
All right, and next, two massive states gearing up to reopen, California and Florida. Why do they appear to be doing so much better than states in the Northeast? Plus, Jeannie on how couples are getting hitched virtually.
Tired of trying to hide your belly bulge, muffin top, or that beer gut? Now that with special guest Bill Gates.
We're completely in uncharted territory.
Or coronavirus, facts and fears. Thursday.
We think we have it very well under control. We have very little problem in this country.
But did they?
The president's focus was not on this coronavirus issue.
One day it's like a miracle. It will disappear.
CNN's Jake Tapper investigates what really happened.
Public health officials were telling me they knew this virus was spreading.
While the president was talking about 15 cases going to zero, they were talking about 15 cases going to the thousands.
The pandemic and the president, Sunday on CNN.
I'm Ivan Watson in Hong Kong, and this is CNN.
I agree. Tonight, Florida and California, two of the country's most populous states, are both announcing plans to reopen. But here's the big question when you think about this. These are huge states with huge cities. How do they have more success in containing the spread than hard-hit New York? Tom Foreman has that story.
Coastal states, both drawing oceans of travelers, home to massive populations, and wildly different in their approaches to containing COVID-19. In California, the earliest reports of the virus spurred the first stay-at-home order in the nation on March 19th.
If you are presumed to be positive or you're waiting for a test result, you need to immediately notify your close contacts so that they can begin to quarantine themselves.
The most populous state clamped down on restaurants, public events, and spaces. The result, a surprisingly low 48,000 cases in a recent assessment, about 1,900 deaths, and plans to relax restrictions.
We believe we are weeks, not months away from making meaningful modifications.
Florida took a different path. The third most populous state did not push residents to stay home until April and did not move to shut down huge spring break crowds on beaches. With so many older, medically vulnerable citizens, epidemiologists feared a huge outbreak. But the current count, again, an unexpectedly low 33,000 cases, approximately 1,200 fatalities. Parts of Florida, too, are poised to reopen.
We're making progress. We need to continue to put people back to work.
Both of those states have fared much better per capita than much smaller Massachusetts, Connecticut, and New Jersey, which racked up considerably higher, horrific infection numbers, and topping them all.
New York State is now the epicenter.
In New York, the death toll reached a new high. New York remains the U.S. epicenter.
With almost 300,000 cases and more than 23,000 deaths, New York is by far the hardest hit state in raw numbers and person for person. Why is the Northeast home to more than half of U.S. COVID-19 deaths? While the region quickly followed California's lead with stay-at-home orders, there is some evidence compliance may have been less robust. Add in the population density of major Northeast cities and the fact that no part of the country relies more on crowded public transit, and that may have been the true formula for disaster. This is largely speculation at this point, but that's one reason why epidemiologists want hospitals to keep as careful record as they can of who shows up, where they have been, and who they had contact with, so they can try to recreate a viral map of sorts of COVID-19's deadly travels. Aaron?
All right, Tom, thank you. And I want to go now to Dr. David Rubin. He's a doctor, a founding co-director of the Policy Lab at Children's Hospital of Philadelphia. And I know, Doctor, you've been, creating a lot of models, tracking, forecasting outbreaks across the country, and also talking about this issue that we're posing, right? And specifically, how it is that the virus can spread not only, more effective at spreading in more dense areas, that is sort of obvious to all of us, but why the death rate is also higher in those areas. Why would that be?
Well, I think there's, it's been a long-held principle in infectious diseases that inoculum is important in terms of severity of disease. We've seen it in other viral infections. We know that the second children in households who have a chickenpox infection in one child, often the second child gets sicker than the first. We've seen even an analysis of a previous influenza epidemic in 1918 that suggested that the greater number of people, individuals were exposed to had been infected, the more likely they had severe disease. And so we're just at the early stage here of getting evidence that SARS-CoV-2 may be similar. And, your witness to this are the 100 doctors who died in Italy. We suspect that they received higher inoculums of virus as they tried to take care of patients in northern Italy, for example, and were likely sicker because of it.
Right. We look at those healthcare professionals, but it's a fascinating point when you talk about the viral load. So just, how important, and this is an important question for how we got here and also how this country's biggest city is going to get out of this. And that is, how big of a problem was the New York City subway?
I think it's a huge problem. I mean, when you compare places like Florida or California to New York City, areas in South Florida were conferred advantages that New York City did not have. They're not as densely populated. They don't have these large mass transit systems that with crowding on the platforms, and they're also warmer. Our newer models, and we have new forecasts coming out on policylab.chop.edu later this week, are going to reveal stronger temperature effects as we're heading into the spring. They're not enough to mitigate all the transmission of the virus, but they're certainly helping places like Florida. And so when you put it together, you have areas of South Florida where most people live in single-family dwellings. There's not a large mass transit system, and they're conferred the advantage of those warmer temperatures.
All right. Well, Dr. Rubin, thank you very much. Really a lot there to think about. I appreciate your time.
Thanks.
And next, Jeannie, on virtual weddings that have gone, shall we say, viral.
Is the best part of my day.
Go through time. So here we are by Friday, a taste of July for some here across the South Central U.S. Records will be challenged for some We're going to be breaking that down more with details later on tonight here on the AccuWeather Network. Here's a list of some of the Texas records in jeopardy.
Cleaning the tub is a backbreaking chore. You scrub those dirty germs and bacteria.
Part of our day.
But the fake news media continues to blame and attack our president like never before as the country tries to come together to beat this virus. President Trump needs to know now, more than ever, that we will stand behind him during this national crisis. Please pick up the phone and call the number on your screen, pledging your support to re-elect President Trump in November.
Greetings, this is Lieutenant Colonel Alan West. Please join me in supporting President Trump by calling the number on your screen. Call now.
Please call 800-657-5948 to send a message that we stand behind our president like never before. Call 800-657-5948 and press 1 now to show your support.
Dump the heavy old hose and get the bullet.
Is responding. And for more on that, I'm joined now by Rebecca Traister, writer at large from New York Magazine, who just published this piece about the allegations titled The Biden Trap. Rebecca, first maybe take me through how you have tracked this story over its development and your sort of evaluation of it.
Well, I've been watching it and reading about it with, obviously intense interest. It had a sort of reverse course from some of the Me Too reporting that broke through in the fall of 2017, the reporting done by Jodi Kantor, Megan Twohey, and Ronan Farrow on Harvey Weinstein, in that it didn't start out as a massive investigative report. It actually, Tara Reid first made the full accusation of assault in a podcast interview with Katie Halper. So initially, it didn't have the sort of full, we've talked to 100 people, we've gone through these documents, and that sort of happened in reverse in this case. And so I have been reading with great interest as sort of different portions of the story have either been denied or seemingly confirmed. And I think it's one of those cases where there's going to be more reporting and we're going to learn more about what we think of these claims with every story that's done. And I bet there are a lot of reporters, I know there are a lot of reporters out there working on it right now.
In terms of the sort of, I think one of the things that happened in the Me Too era was thinking about how to evaluate claims like this and what evidence is sort of corroborative and what's dispositive, and the fact that in almost all cases it's extremely difficult to arrive at some definitive accounting in the sort of evidentiary record. I will say that in following this, one of the things that happened to Me Too and a piece of evidence that has risen in how I evaluate these stories is a somewhat contemporaneous disclosure to a trusted person who then tells a reporter about it. That is what has happened here. And to me, that has been, in terms of what the evidentiary record is, has raised it a bit in my own view of this.
I feel the same way.
That point, work with the WHO to try to get to it. But whatever we can do through to get to the Chinese government, we ought to be doing that. But I think that's a tougher nut to crack than the pressure we can bring to bear to get a lot of this information out through the World Health Organization. And I just had a briefing this morning with the ambassador to the United Nations organizations in Geneva, and basically that conversation dealt with the fact that this head of this Ethiopian that heads up the World Health Organization is really very protective of China through his leadership, protective of China itself, and then not reducing China's influence within the World Health Organization.
Why is he so protective of China? I mean, China has been reckless with its laboratories in the past. So the SARS coronavirus escaped in 2004. It walked out with an infected researcher. It killed at least one person, possibly 9 people. This has happened before. So why is WHO so protective, the leader of WHO, so protective of China?
Well, I think it's quite obvious for political reasons, because he probably wouldn't have his job if China hadn't backed him, and China got more behind this guy than we were able to get behind a British person that we wanted in the same position. And not only that, but the whole Chinese Communist Party and their government's efforts is to take over leadership of all these UN organizations, just to increase their power, their prestige. So I think that's the main reason, a personal one. And I suppose that somebody's going to argue, well, China's the second largest economy in the world. They ought to have something to say just from that position. But we put in $500 million a year compared to $40 million a year by the Chinese. We ought to have something to say, and we need more Americans working in that organization. Somebody gave me a figure of only 3% of the employees come from the United States.
Okay. Senator, you're terrific. You've been a man of integrity and decency. I followed you for decades. You're a great man, sir. Thank you for your service to our country. Senator Chuck Grassley, thanks for joining us. I'm Elizabeth McDonald. You're watching the Evening Edit on Fox Business, and that does it for us. Thanks again for joining us. We will stay on all developing stories tomorrow night. Join us. Have a good evening.
A hard-charging real estate mogul who's ahead of his time.
Edmund was a real visionary.
Meets a cutting-edge furniture designer.
There was a lot of synergy when the two of them came together.
He fills one home with ultra-modern pieces, then another and another.
They jumped on it. They puked on
thing after all. Really? For the love of logic. Just 2 days since Pence said we should all be proud about the step up on testing. When will the doublespeak end? No wonder so many people are looking to governors for guidance. We also have another big story tonight. What is the real deal about research on a new COVID treatment? Is this about hope, or is a team researcher study perfect test? For all the doubt, we do know something, and it is amazing. I is replaced by even illness becomes wellness. That saying was from Malcolm X. We must be together as ever as one. Let's get after it. All right, our nation's top infectious disease expert just said today that there is a drug that may be able to block this virus.
If you look at the time to recovery being shorter in the remdesivir arm, it was 11 days compared to 15 days. And that's a p-value for the scientists who are listening of 0.001. So that's something that, although a 31% improvement doesn't seem like a knockout 100%, it is a very important proof of concept, because what it is proven is that a drug can block this virus.
Okay, let's all say the name of the drug.
Doing the hardest work on Earth, fighting to keep people alive in the biggest coronavirus epidemic on Earth. So we have tried to stay in touch with them. We've tried to keep hearing from them on their own terms as much as we can. But tonight, here's one that I want you to see that did not come to us because we asked a doctor or a nurse to put on a GoPro or grab their phone and make a video for us. This is something that we got from Waterloo Community Television in Black Hawk County, Iowa. And I'll just tell you, the reason I want to show this to you is that, my God, if there's one thing I have seen in about a week that has made me sit down and try to figure out if I'm doing enough, if there's anything else that I can do, I think it was seeing this. Maybe that's in part because I'm not sure anybody involved in this ever thought it would be seen outside Black Hawk County, Iowa. Here's Black Hawk County on a map, if you want to picture it. Here's the big Tyson meat processing plant there, where apparently hundreds of people got infected on the job, and the state kept the plant open anyway through last week. But now, little Black Hawk County, Iowa, population 130,000 in the whole county. Now, because of the outbreak that started in that plant, they've got over 1,300 coronavirus cases in that county, and they've got a climbing death toll. And no, they don't have a ton of healthcare resources in that county. They just don't. They're not designed for a pandemic, but that is what they are coping with now. And so I want you to meet tonight the medical director of one of their local clinics. Her name is Dr. Sharon DeClose. This is, again, Waterloo Community Television. When you hear the White House or conservative TV or your home state governor brag about how things are better, we're over this, and this isn't New York City here, and trying to stop this virus is worse than the virus itself, just introduce them to Dr. DeClose in the middle of Iowa.
Thank God there are a lot of people that have not been personally touched by this. And thank God there are a lot of people out there that don't know somebody that has been personally touched by this. But for people who work in the healthcare profession, they are the front lines of this. And they've had to go through that emotional roller coaster of feeling the wave that's coming. Initially, you know it's coming. You're watching New York City. You're watching all that you go through, but you're distance away. You're seeing it, but not really feeling it. You feel sympathy. You're like, oh my gosh, that's just I'm so sorry for them. But you're still over here feeling A-okay. And then it gets a little closer. And then it starts to hit your community. And then we saw the surge. And then we felt that emotional, okay, here it comes. This wave is now coming. Here comes the tsunami. And then you change a little bit more as far as working around how many positions can I change to really take care of this wave of people as they come in? And as you do that, then you're trying to take care of your staff who start to feel like they start to get sick. And so as the wave comes in, then you have a portion of your staff that's out because you're worried about illness and they don't feel well. So you get over that. And then people go into the hospital. And then finally, you start to see the deaths. And I think that's the thing that really gets you, is you see the impact on the family who have to sit at home and can't be with their loved one, who have to FaceTime as somebody is going through one of the most traumatic experiences of their life. We're going to FaceTime. And that's the part that finally gets very overwhelming. And I know in our organization, that is what we're feeling. And that's what I've been feeling. And it's hard because you start to go through the grief of realizing, again, this is not a sprint, it's a marathon. You have to set your mind to work on your stamina. And the governor announces the opening. Now more than ever, and especially in Black Hawk County, the social distancing is so important. And for me, it is, I think about what would the person say to me who just died from this? How would they advocate helping other people not go through what they just went through? So that's what I think about. So for the other businesses, churches, restaurants, think about your community and think about your actions and think about how you can best serve the greater good and really, really work on social distancing. because I can tell you it is a heavy load to carry. And my biggest fear as I encourage my staff to come to work every day and be compassionate and help people. It's my biggest fear is I'm going to lose one of them. And that I have to carry on my shoulders because I'm asking them to do a service that I realize it is very hard. And I'm asking them, I know they've got that pit in the middle of their stomach, and you get up and you come to work and you think, okay, is this the day? So please work on the social distancing. Please help people out so the number of deaths that we have to endure are minimized as much as they can. That's my plea today. Thank you.
So the number of deaths that we have to endure are minimized as much as they can. Black Hawk County, Iowa, Waterloo, Iowa. The impact on the doctors there, that's the medical director of one of their clinics. I mean, that's what happens when you get a big outbreak of hundreds of cases. That happens among the people who work at a meat processing plant somewhere in America. And it's not just a food supply chain issue. It's not just an issue of the economics of those plants. It's not even just the immense tragedy of hundreds of people from the same workplace all getting sick and a number of them starting to die. I mean,
there's a pattern here. And the pattern here is that this virus has hit old folks' homes pertaining to taking the feeble and the weak out. And there's also a pattern that this virus thrives off of cold, damp weather that basically intensifies this virus. There's no doubt that as it warms up through the summer months, it will merge into other areas and become dormant. But then as soon as it cools back off this fall and we start having rain and cold weather, this virus will merge unless we have got some sort of an antidote to be able to stop it. It's almost like it's got a mind of its own. And it selects and picks its victims towards who's just going to get a minor cold versus who is actually going to die from it. That's the reason why I think it's as much superficial pertaining to it being spiritual as it is biological pertaining to it being some sort of microscopic germ. I'm not saying that the microscopic germ isn't true. I think the entity uses the germ to attack its victims. But as it's attacking its victims, it has to live in a more settling, pleasant environment. And the settling, pleasant environment is not of heat, but of damp coldness. That's the reason why we're seeing a pattern here throughout these butcher shops, that these big factories to where they're processing meat, because by and large, these factories that are in there doing this are going to be cold and damp per se, because that helps preserve the meat, and it also helps retain any type of regular germs that form on regular countertops. That's the whole purpose for having them in the freezers and being in a cool environment like that. But this particular germ seems to have a different familiarity about itself, to the point that it actually likes cold. It likes dampness. And that's what it thrives off of. And that's the reason why that I believe that we have seen such a pattern here lately pertaining to the butcher's chops of all the COVID-19 cases. That's my opinion, and it didn't cost you nothing to hear my opinion.
It's huge outbreaks of hundreds of cases. In the places where we're getting big outbreaks, at meat plants, at prisons, at big jails, at nursing homes, at all the places we now know
most of your jails are kept at a certain temperature. Once more, to hold down staph infection and to keep the prisoners basically in a slumber state, because the hotter that a jail becomes, the more you have a tendency of a jailbreak or an uprising in the jail. Because the hotter it becomes, the hotter tempers become. The hotter temper become, the more likely that something bad is going to happen in that jail system. So they keep their jails very, very cool, very, very cold. Most of them do, to hold down germs and also help to hold down the prisoners. Because whenever you're sitting there shaking on a cold piece of concrete or a cold piece of steel, and they give you this little bitty thin blanket that's about as thick as a Kleenex that you have to wrap yourself in to stay warm, you're not going to have a tendency towards wanting to get frisky with anybody, because now you're concentrating more on staying warm than you are towards wanting to become irritable with somebody. Once more, this coronavirus has a tendency of liking this environment more so than the actual everyday germ. It has different characteristics about it.
Americans are doing the worst job keeping other people alive and keeping them from being infected. All the places we are seeing the worst outbreaks, these are not islands of individual failure, where these infection explosions are confined within the four walls of these facilities. These are all outbreaks of a very contagious communicable disease that then creates not only immense infection inside that facility, but a large outbreak of new infection and then mild illness and then severe illness and ultimately death around wherever those facilities are. And that is what then pours into and pours over whatever hospital and health and ultimately morgue resources there are in that area. And that is why it is more than just bad that the places that have so many of these huge outbreaks often tend to be the places politically that want to open stuff up the fastest, or who never shut down non-essential businesses and told people to stay at home in the first place.
Has the incidence of healthcare workers coming down or testing positive for COVID-19 affected our operations? And the answer to that is yes. We have nurses that are being exposed to it. We have lots of people that are getting tested now. And it's not just Unity Point Clinic, it's healthcare workers across the Cedar Valley. So it's every one of our organizations and the nursing homes. And anybody that's involved in healthcare, that's where we're starting to see the numbers start to climb. So that's a major problem. And as we continue to see surge in the hospital, we are moving more resources and more people into the hospital to try to address the care that our patients need there. And they're doing the same thing at Mercy One. So that's taking more nurses and staff and putting them directly in harm's way to take care of the patients that need to be taken care of.
He's the medical director at the main hospital in Waterloo, Iowa. They just had to build a second respiratory clinic at that facility because of the high volume of patients that are now surging into that hospital in acute respiratory need because they are COVID patients. With that unfolding in Black Hawk County, including now starting to lose healthcare staff as the patient numbers surge in the hospitals and the clinics, with the Sioux City, Iowa area also being another place in that state with one of the fastest growing outbreaks on the planet right now, with that problem they've got in Black Hawk County, with the problem they've got around Sioux City. Iowa Republican Governor Kay Reynolds this week is ordering businesses in Iowa to open up. And she has now threatened workers in the state of Iowa that if for some reason they are afraid of unsafe conditions at their workplace, if you're worried that the way your workplace is set up poses a risk of you getting infected on the job, well, tough. According to your governor, you have to go anyway. The governor is ordering businesses back open and going a step further, explicitly ordering that if you believe your workplace isn't safe and so you don't show up for work, she will zero out any unemployment benefits that you have been getting. Governor Pete Ricketts, also a Republican governor in Nebraska, is doing the same thing to working people in his state as well. But this is what's emerging as Republican Party policy or maybe strategy now that we've got over 60,000 Americans dead. The New York Times today reporting on a, quote, network of conservative leaders, donors, and organizations that has launched a legal onslaught against state and local restrictions intended to slow the spread of the coronavirus. The Times further reporting that these conservative groups mounting this effort have become, quote, emboldened in recent days by ever more explicit signs that U.S. Attorney General William Barr and the Justice Department may take their side to help them legally dismantle public health efforts to slow the virus and to limit the death toll. And they're doing this because well, this is what they're doing. Because that's how the administration and the Republican Party and the conservative media are going to want to go down in history here. 60,000 Americans dead. Yeah, sounds like a good start. What else can we do? I mean, it's fun.
They're starting to prioritize a lot of these governors, and because of it, they're weighing out the life versus the profit gain or the loss of the economy. And unless there is a big, humongous outbreak similar to New York City, they're probably going to keep the shop open. And basically what we're doing, we're asking for a problem that could merge this fall, or maybe not even merge this fall. We're asking for a problem if we do not continue to use safeguarded measures in distancing ourselves in every way possible, of not knowing if somebody is once more a carrier and all of a sudden you become exposed to it and it literally knocks you for a stump. They claim, I don't know how true this is, but they're saying now that over 60% of the population of America will become infected with the COVID-19 coronavirus before they have an antidote that will literally fight against it, similar towards how they done smallpox, measles, tuberculosis, and other outbreaks that has occurred throughout the year. Throughout the years, they claim that they're projecting that over 60% of the American people, before this comes to a halt, will be infected by this coronavirus COVID-19 before it's over with. And I'm sure that's in the span of about a year or two, or maybe 3 or 4 years. In the meantime, some of us make it, some of us don't. Some of us live through it. Some of us just get sicker than you know what, and some of us barely catch a cold. So this is really mind-boggling and puzzling to the professional world pertaining to the doctors and the scientists that's having to deal with this particular smart, merging, mutating disease.
I think if this had been their take from the outset, right, before Americans started dying in huge numbers, we're going to legally challenge anything you do to try to slow this virus or slow the death toll from piling up. It would be one thing if they had sort of taken that stance from the very beginning, but they didn't take that stance from the beginning. This, increasingly, is their unified position now Now that this many Americans have died this quickly, now that we've outpaced by 4 months the date by which the favored White House model said we'd hit this many Americans dead. They said we maybe hit 61,000 Americans dead the first week in August. Well, it's still April, and here we are. So now is when they really want to put the screws to the doctors and the nurses in the hospitals. Let's see how high we can get the body count. Let's see how many people we can get infected all at the same time. It's just now's the time. It's just incredible to see. To live through this, it is hard to imagine what would be appropriate political accountability at the ballot box for people who are doing this at some point, but that's where we are. That's where the Republican Party is. That's where the conservative media is. It's the administration is. And so the president issued this executive order late last night mandating the opening of meat processing plants across the country. Technically, despite the hype and the way they build it, he didn't really order meat plants to stay open. He basically just moved to block any state from being able to close a meat plant. But just think about this for one hot second. Why have meat plants been closing all over the place? And right? Why have meat plants been closing? It's not like it's been some
Because they've been targeted.
blue state plot to make everybody a vegan or to make meat packing look bad. These plants have been closing in all of these different states all over the country for one very simple, very consistent reason. Because these facilities are in the elite, the very top rung of the places in America where the most people are being infected the most quickly by this virus. They have proved to be an incredibly efficient location for creating enormous outbreaks of coronavirus and all of the subsequent hospitalizations and deaths that come from that.
An incubator.
I mean, to the point where otherwise stoic doctors in the heartland who have never been known before to cry in public, right? Medical directors of hospitals in northeastern Iowa are weeping.
It's an incubator. But so is a boat. So is an airplane. Anywhere you confine a bunch of people together and everybody's breathing and sneezing and breathing each other's air, it's an incubator. And like I said a while ago, this disease is more attracted to wet, damp influences than it is a dry climate. Which tells me that this fall, this winter, unless they got some sort of an antidote to give everybody that'll help to whip it, we ain't seen nothing yet. There's a strong possibility that this thing could come back just like a mutating cancer cell after somebody goes through chemotherapy that they missed. And usually whenever it comes back the second time, usually it comes back with vengeance. And you know what? If you'll study most pandemics, it's the second wave that's the most lethiest, that does the most damage. Once more, they didn't have no idea that society would be affected over here in America because so many people has pulled themselves out on a limb towards borrowing and paying later, that they didn't realize what kind of repercussions that this was going to form in the financial banking institution department of the economy failure right here in the good old USA. You got all these people that's obligated to all these payments, car payments, truck payments, house payments, insurance payments, boat payments, four-wheeler payments, child proof payments, hospital payments, education, school, college payments. You got all these people that have been trying to borrow from Paul to pay Peter, and now all of a sudden they're not going to be able to pay Peter. It's going to cause an economical collapse. And that's what these governors are seeing. That's what these financial institutions are seeing. And because of it, they're putting aside people's health to some degree, and they're no longer prioritizing it like they was 30 days ago or 6 weeks ago, whenever all this first come out into the public. And as long as they can maintain a certain amount of sickness and a certain amount of death, they're going to look at it in the scale of a war, that as long as the fatalities stay with an acceptable range, they're going to continue to hump and bump and work and try to keep everybody paying their bills. It's sad. We're in a very, very difficult moment in a lot of people's lives that have went out and put themselves out on a financial limb like this. It's really, really sad. And to hear these governors that's putting in these stipulations by saying that if you've got a job and if you don't go to it, that your unemployment will be cut off, that really speaks volumes about the American criteria towards where we really stand as a society in prioritizing people's health over the good old American greed or the good old American dollar bill. It's sad. It is really, really sad.
In public over the toll on their doctors and nurses, right? Begging the public, please do social distancing, even though the governor's telling you it's all fine to open up now.
I'm going to end right there. I'm going to let my viewers use their own judgment in what's going on here. And as we say here at 291 Thompson Road, and we continue to say, good luck to all of us. We pray for each and every person out there. And it's really, really sad that so many people are having to pay with their very lives just to be able to drive a nicer vehicle or to live in a nicer home or to have a nicer lifestyle. It's really, really sad that these people basically are going to pay for this type of luxury with their very own lives if they don't watch. Shalom. Shalom.